Berberine is a chemical found in some plants like European barberry, golden seal, gold thread, Oregon grape, philodendron, and tree turmeric. Berberine is a bitter-tasting and yellow-colored chemical. It might help strengthen the heartbeat, which could benefit people with certain heart conditions. It might also kill bacteria, help regulate how the body uses sugar in the blood, and help reduce swelling. People most commonly use berberine for diabetes, high levels of cholesterol or other fats in the blood, and high blood pressure. It is also used for burns, canker sores, liver disease, and many other conditions, but there is no good scientific evidence to support many of these uses. Canker sores. Applying a gel containing berberine can reduce pain, redness, oozing, and the size of canker sores. Diabetes. Taking berberine by mouth seems to slightly reduce blood sugar levels in people with diabetes. A digestive tract infection that can lead to ulcers, known as Helicobacter pylori or H. pylori. Adding berberine by mouth to multiple medications that are typically used to treat this condition might work as well as other accepted treatments for this condition. These other treatments also use multiple medications. High levels of cholesterol or other fats, also called lipids, in the blood, known as hyperlipidemia. Taking berberine by mouth alone or with other ingredients might help lower total cholesterol, low-density lipoprotein, often referred to as LDL or bad cholesterol, and triglyceride levels in people with high cholesterol. High blood pressure. Taking 0.9 grams of berberine by mouth daily along with the blood pressure-lowering drug amlodipine reduces blood pressure better than taking amlodipine alone in people with high blood pressure. A hormonal disorder that causes enlarged ovaries with cysts, known as polycystic ovary syndrome or PCOS. Taking berberine by mouth might lower blood sugar, improve cholesterol and triglyceride levels, reduce testosterone levels, and lower waist-to-hip ratio in people with PCOS. There's interest in using berberine for a number of other purposes, but there isn't enough reliable information to say whether it might be helpful. When taken by mouth, berberine is possibly safe for most adults. It's been used safely in doses up to 1.5 grams daily for 6 months. Common side effects include diarrhea, constipation, gas, and upset stomach. When applied to the skin, berberine is possibly safe for most adults when used short-term. When taken by mouth, berberine is possibly safe for most adults. It's been used safely in doses up to 1.5 grams daily for 6 months. Common side effects include diarrhea, constipation, gas, and upset stomach. When applied to the skin, berberine is possibly safe for most adults when used short-term. Pregnancy. It's likely unsafe to take berberine by mouth if you are pregnant. Berberine can cross the placenta and might cause harm to the fetus. Kernicterus, a type of brain damage, has developed in newborn infants exposed to berberine. Breastfeeding. It's likely unsafe to take berberine if you're breastfeeding. Berberine can be transferred to the infant through breast milk, and it might cause harm. This information is meant to supplement, not replace advice from your doctor or healthcare provider, and is not meant to cover all possible uses, precautions, interactions, or adverse effects. This information may not fit your specific health circumstances. Never delay or disregard seeking professional medical advice from your doctor or other qualified healthcare provider because of something you have read on WebMD. You should always speak with your doctor or healthcare professional before you start, stop, or change any prescribed part of your healthcare plan or treatment, and to determine what course of therapy is right for you. I left you some link from Amazon down below in the description for you to try. Thank you for watching, and please don't forget to hit the subscribe button for more helpful videos. Take care of yourself, and be well.